Stick your tongue out right now and look at it. I'm serious. Open your camera or walk to a mirror. Do it before this video ends, because what you're about to see might be one of the most important early warning signals your body has ever sent you. Most people check their tongue exactly 0 times in their life. Their doctor barely looks at it during checkups. And yet, Eastern medicine has used the tongue as a diagnostic tool for over 3,000 years. And now, modern clinical research is catching up. Your tongue is a direct window into one of the most powerful and most abused organs in your body, your liver. The liver performs over 500 documented functions. It filters every drop of blood in your body. It processes everything you eat, drink, breathe, and absorb through your skin. When it starts struggling, it sends signals. And one of the first places those signals appear, right there on your tongue. Today I'm going to walk you through 7 specific signs visible on or around your tongue, your mouth, and your face that may indicate your liver is under serious stress. I'll explain exactly what's happening biologically, why it happens, and what the science says. Stay until sign number 4. That's the one most people completely miss, and it's often the earliest indicator of all. My name is Dr. Norwick. I've spent 9 years in clinical practice, and one pattern I've seen repeatedly is this. Patients who develop serious liver conditions almost always had warning signs years, sometimes decades, before their diagnosis. Signs they noticed but didn't understand. Signs no one explained to them. That's not acceptable. Your body is constantly communicating with you. Our job, together, is to learn the language. Everything I cover today is grounded in peer-reviewed research. I'll keep the biology clear and practical, and at the end, I'll give you a simple self-assessment you can do right now. Let's begin. Sign number 1, yellow or pale. Yellow tongue. Coating. A healthy tongue should be pink with a thin, almost invisible white coating. That's normal. But when the tongue develops a yellow tinge, particularly a coating that sits on top of the tongue surface, this is clinically significant. What's happening biologically? Your liver produces bile, a digestive fluid that breaks down fats. When the liver becomes congested, inflamed, or overloaded, bile metabolism becomes disrupted. Bilirubin, a yellow-orange compound produced when the liver breaks down old red blood cells, can accumulate in body tissues. When bilirubin builds up in skin and mucous membranes, including the tongue and the whites of the eyes, you get yellow discoloration. This is called jaundice. But here's the critical thing most people don't know. Mild yellow tongue coating can appear before full jaundice develops, before it shows in your eyes or urine. The tongue can show it first. A persistent, thick, or deepening yellow coating, especially combined with any other signs I'll mention today, warrants a liver function blood panel. Ask your doctor for ALT, AST, bilirubin, and alkaline phosphatase. Sign number 2, swollen, puffy, or scalloped edge tongue. Look at the edges of your tongue right now. Do they have indentations, like teeth marks pressed into the sides? This pattern is called a scalloped tongue, and it's something I want you to take seriously. A scalloped tongue occurs when the tongue swells to the point that it presses against your teeth, leaving those wave-like impressions. The underlying cause is fluid retention and inflammatory processes, and the liver is directly involved in both. The liver-fluid connection. The liver produces albumin, the primary protein that keeps fluid inside your blood vessels. When the liver is compromised and albumin production drops, fluid leaks out of blood vessels into surrounding tissues. This is called edema, and it can affect the tongue just as it affects the ankles and abdomen. Additionally, a stressed liver creates a state of low-grade systemic inflammation. Inflammatory compounds called cytokines circulate throughout the body and cause tissue swelling, including in the tongue. Important: scalloped tongue is also associated with thyroid dysfunction. Always check both thyroid and liver markers together if you notice this sign. Sign 3, deep red, purple, or unusually pale. Tongue color: a tongue that is unusually dark red, almost purplish or wine-colored, is a sign your body wants you to pay attention to circulation and liver stress. The liver sits at the center of your venous blood flow. Blood returning from your digestive system passes through the portal vein directly into the liver before going anywhere else. When the liver becomes scarred or congested, a process called fibrosis, and in advanced stages, cirrhosis, blood cannot flow through it efficiently. Portal hypertension and tongue color. Pressure builds in the portal vein system. This increased venous pressure backs up into surrounding blood vessels, including those supplying the tongue, creating that deep, engorged, reddish-purple discoloration. On the opposite end, a pale white or very light tongue can indicate anemia, often associated with liver disease because the liver plays a key role in producing proteins needed for healthy red blood cell production. Sign 4. Visible, dark, twisted veins under the tongue. This is the sign I mentioned at the start, the one most people miss entirely. Lift your tongue up right now. Press the tip to the roof of your mouth and look at the underside in a mirror. You should see two thin, bluish-purple veins running parallel along the underside, called sublingual veins. In a healthy person, these are thin, relatively flat, not prominently visible. What I want you to look for are those veins thick, tortuous, meaning twisted, branching, or knotted-looking, noticeably dark purple or even blue-black. Why this matters? The sublingual veins are sensitive to changes in venous pressure and blood composition. When liver function is impaired and portal pressure rises, these veins can become engorged and visibly prominent. In traditional diagnostic medicine, prominent sublingual veins have been associated with what practitioners call blood stagnation for centuries. Contemporary research on microcirculation is exploring these as potential non-invasive markers of hepatic circulatory stress. This is not a standalone diagnostic test, but it is a meaningful clinical observation, especially when paired with other signs on this list. If yours look markedly darker or thicker than they once did, mention it to your physician. Sign 5. Persistent sweet or musty breath. That brushing does not fix. Everyone gets bad breath occasionally, but there's a specific type clinically associated with liver dysfunction, and it has a distinctive quality worth knowing. It's called fetor hepaticus, literally the breath of the liver. It has a sweet, musty, or faintly ammonia-like quality. Some describe it as smelling like raw liver. It does not respond to mouthwash or brushing because it's not coming from the mouth. The biological mechanism. Your liver is responsible for converting ammonia, a byproduct of protein breakdown, into urea for excretion through urine. When the liver can't do this efficiently, ammonia accumulates in the bloodstream and is exhaled through the lungs. Additionally, a class of compounds called volatile sulfur compounds, normally neutralized by the liver, begin escaping into the breath. The result is that characteristic smell that no amount of dental hygiene resolves. If someone close to you has mentioned this smell on your breath persistently, treat that as clinical information. Request a liver enzyme panel. Sign 6. Chronic dry mouth, cracked lip corners, persistent thirst. The liver plays a significant role in fluid regulation through its production of plasma proteins, its processing of hormones, and its role in bile production. When the liver is under chronic stress, these functions degrade, creating a state of cellular dehydration even in people who drink adequate water. This shows up as chronic dry mouth, cracking at the corners of the lips, called angular cheilitis, and a thirst that's never quite satisfied. The aldosterone connection. The liver also processes a hormone called aldosterone, which regulates sodium and water retention in the kidneys. When liver function declines, aldosterone can accumulate, causing sodium retention and a disruption in thirst, signaling that no amount of water seems to resolve. Dry, cracked lips plus persistent thirst plus any of the tongue signs covered today. That's a pattern, not a coincidence. That warrants investigation. Sign 7. Thick white or gray coating that returns after brushing. A thin white coating on the tongue is completely normal. But a thick, persistent, pasty white or gray coating, one that comes back quickly after you brush, is a different matter entirely. This is called a furred tongue. It represents an overgrowth of dead cells, bacteria, and debris on the tongue surface. A healthy immune system constantly renews tongue tissue and controls bacterial populations. When it can't, this buildup accumulates. The liver immunity link. The liver is a primary immune organ. It contains specialized immune cells called Kupffer cells, the largest population of resident macrophages in the body. These cells identify and eliminate pathogens and cellular debris. When liver function is impaired, their activity drops. The result is weakened local immunity in the oral cavity, leading to that persistent coating, often accompanied by a sensation that the mouth never feels truly clean. This coating can also indicate candida overgrowth, a fungal condition more likely to establish itself when the liver's detoxification burden is high and immune surveillance is reduced. Your 7 signs self-assessment. Let's bring this together. Here are your 7 signs to check right now. 1. Yellow or pale yellow coating on the tongue surface. 2. Swollen, puffy tongue with scalloped or indented edges. 3. Unusually dark red, purple, or pale white tongue color. 4. Thick, dark, twisted veins visible under the tongue. 5. Sweet, musty, or ammonia-like breath unresponsive to brushing. 6. Persistent dry mouth, cracked lip corners, unquenched thirst. 7. Thick white or gray tongue coating that returns after brushing. One of these signs in isolation may not be significant. Most can have other causes. 2 or more of these signs, particularly ones that have developed or worsened over months, that's a pattern. A pattern that warrants a conversation with your doctor and a basic liver function blood panel. The test is inexpensive, widely available, and can detect problems years before serious damage occurs. Ask your doctor for ALT, AST, GGT, alkaline phosphatase, and bilirubin. These are standard, low-cost, and often covered by insurance. Evidence-based liver support. This video is education, not a treatment plan. If you see these signs, see a doctor. But there are well-researched lifestyle factors that genuinely support liver health. Alcohol is the most well-documented source of preventable liver damage in the Western world. Reducing or eliminating it is the single highest impact change most people can make. This is not opinion. It is supported by decades of consistent research. Processed fructose, particularly high fructose corn syrup in processed foods and sugary drinks, is metabolized almost exclusively by the liver. Chronic overconsumption is directly linked to non-alcoholic fatty liver disease, now the most common liver condition worldwide. Regular physical movement, even 30 minutes of walking daily, has been shown in controlled studies to reduce liver fat and improve liver enzyme levels in people with early fatty liver disease. And as covered in a previous video, vitamin D deficiency has a direct regulatory effect on liver cell function and fibrosis risk. Get your 25-hydroxy vitamin D level tested. If you're deficient, correct it under proper medical guidance. Here is what I want you to take away from this. Your liver is one of the most resilient organs in your body. It can regenerate, it can recover, if you give it the chance early enough. But it can only do that if you catch problems before they become advanced. Your tongue is talking to you. Your mouth is sending signals. The question is whether you're listening. Share this video with someone you care about, a parent, a sibling, a close friend. The signs we covered today are easy to miss, easy to dismiss, and easy to act on early, if you know what to look for. Subscribe to this channel if you haven't already. Every week I break down the signals your body sends, and the science behind what they mean. No scare tactics, no supplements to sell, just clear information you can actually use. I'll see you in the next one.